My first contact with Waverley Care was September 2016. I had become very ill. Part of my illness was hepatitis C. I'd never heard of Waverley Care or Milestone before, but they suggested that I came for respite. So initially they said a week. After much persuasion, I did come, and I ended up staying for quite a few months, not just a week.
My honest bit is, when I volunteered with Waverley Care for the first time, I just fell in love with the organization, and it started at Milestone when I came here to see how the organization is. And when I got my first full-time employment job, my intention was to stay for 2 years. That's what I thought in my mind, I would stay for 2 years. But after 2 years, I just felt like I never wanted to work for anybody else.
With Waverley Care, it's really quite open, so there's no kind of like barrier to how much you can help people. You
can work with someone for a long period of time, and that's not working with them, you know, every week necessarily, but it's when they need something, they know that they can come back to us, and we're not going to say, oh, you know, oh, because you're this age now, you have to go somewhere else. So that is one of the absolutely amazing things about Waverley Care, is we will keep supporting people as long as we are here.
And I think in order to work with this population, you have to be non-judgmental. That's the first thing. You have to accept individuals as they come to you. You can't make any assumptions about them. You have to be open and really good listeners and give them time. And all the Waverley Care workers that I've met, without fail, actually all have those qualities, I think.
I think that our services are as important as ever, because in Highland there is still such a stigma around bloodborne virus status and sexuality. A lot of people still hold traditional values, so if Waverley Care didn't exist in Highland, we would have a huge lack of education around bloodborne viruses and sexuality, not just amongst professionals but with young people as well, which are obviously our next generation.
When you look at the hierarchy of needs, or the pyramid of needs for any human being, health sits fourth on the pyramid. HIV and sexual health is not their first priority. Their first priority are to do with education, housing, employment, you know, name it. It's not just us coming talk about sexual health, HIV. It's also looking at their priority needs.
For me, it always comes back to stigma. Working with young people and watching them grow, and at the same time really stifling parts of who they are, because they're still so worried about how people are going to react to their HIV diagnosis.
With our kind of external partners and service users, it's always nice to see that we feel that we're trusted by them. They always seem to come back to us for training or for additional services that they may have accessed in the past, or there may be a new client who has maybe heard from us through word of mouth and know that we're an organisation to be trusted.
As an NHS employee, we can cover the sort of physical health care needs of patients and their mental health care needs to a degree, but there needs to be a sort of bridge, I think, between a lot of the needs that the patients have in the community and their sort of ability to engage with their healthcare needs as well.
I started helping during the festival, bucket shaking. Then I got asked to do a couple of talks for them about my experience of Waverley Care, and obviously hepatitis C. So I've done that, and I've loved that, absolutely loved it. My heart's always been with Waverley Care, and my dream was to work for them. A job came up for volunteer coordinator, and I was very fortunate that I got the job, and I started in September. So that was like my dream come true. So I've done like a full circle. It's been 2 years service user, volunteer, and now I'm a paid member of staff, which is amazing.